My micro-preemie spent 87 days in NICU. When discharged, I had so many questions in mind, and the main goal was to find the right pediatrician for my son. Today, I'm so excited to interview an especially caring and knowledgeable pediatrician, Dr. Yekaterina Belousov. I'm so grateful to her that she helped me to gain confidence in taking care of my baby. Hi, Dr. Belousov. Thank you
Hello.
for joining me today.
Yes, thank you for having me.
You are a real gem. You're a doctor who every single appointment took time to answer all my questions, to explain things and give extra tips on how to handle and how to help my baby preemie to thrive. So I hope today's interview will help other parents of preemies as well. Let's jump straight to the questions.
Sounds good.
Okay, so my first question is about breast milk. I've been told in NICU that breast milk is a liquid gold for preemies that can help a baby to fight infections and get stronger. And even if mom cannot provide with her breast milk, the baby will get milk from donors. But once the baby is close to due date, doctors usually approve using formula as a main source of food or to supplement with breast milk just to help to gain calories. Now my question, if one lucky mom, once she got home with the baby after a long stay in NICU and she has a good milk supply, is it okay to exclusively breastfeed, or still because her baby is former preemie, she needs to put baby on the formula just to help to gain extra calories?
That's a great question. I definitely support breastfeeding, and however we can have that as the priority for nutrition, that's the ideal. And then it's very much on an individual basis. So there are certain babies that need the higher calories, and the formula has the 22 calorie, the 24 calorie. It can even be fortified up higher. And there are situations where the mother's breast milk can be used and fortified up as well to the higher calories. For us as physicians, what we look at is optimizing the nutrition for the baby for growth and development. And especially at the end, in that third trimester, the babies are missing out on getting calcium and phosphorus and magnesium from mom. And so a lot of the premature baby formulas actually have more of that in them. So that's another consideration. So if it's very much on an individual basis, I'm definitely a supporter, and I've had moms successfully do that where they were breastfeeding and we did have them fortify some of the bottles. We were with either a higher calorie formula that there's a specific way that it can be done, or a fortifier. And we follow the growth and the weight. And if the baby is tracking well, then there's really no reason to then have to just switch it out into formula.
And the high calorie formula, is it still mild on stomach, or it will cause constipation at some point?
What I've found is that premature babies, their stomachs are more sensitive than the full-term babies. And I would say all babies go through this transition where their digestive tract starts maturing, especially like in the first few weeks leading up to the first few months. And that's where we get the term colic. The baby gets colicky and gassy and fussy. So it's also very individualized, because I've seen babies do perfectly fine with the standard high-calorie formulas, whereas other that are for premature babies. And then I've seen a lot that would start having more spitting up, more gassiness, more fussiness, or constipation, or very liquidy stools. And then it becomes a discussion of what is the best next step for the baby. And there are formulas that are more, we call them hydrolyzed, they're more digested. So they should be easier for the baby to digest. They are not higher calorie. There's ways to work around that, but so that's another option. But it ends up being on an individual basis where we have that discussion. Does it make sense then to just push through, let the baby, just do supportive things for the baby, gas drops and whatnot, or is it so bad that the baby really needs to be changed?
Okay, interesting. My next question is about vitamins. Do you recommend any vitamins or supplements to give preemie on daily basis? If yes, when to start and for how long?
Yes, so the premature baby, like I mentioned, misses out on certain vitamins and minerals in that third trimester. And a lot of the babies also end up being anemic. So we do want to do iron supplements for the premature baby. Vitamin D is also very important for all babies, but especially the premature
Just from
baby.
the start, when parents bring baby home, so milk, formula, and vitamins at the same time?
Usually it's recommended between 2 and 6 weeks. So some of the babies, depending on how long they're in the NICU, a lot of them I see already being sent home on the vitamins. And the most common one I see is the polyvisol with iron. So it has vitamin D, some other vitamins, and then also iron added in. That's appropriate for the baby. And then parents do it once or twice a day, depending on...
Yeah, my son took polyvisol.
Yes.
Thank you for answering this question. And my next one is about reflux. I'll give you a little bit background what actually happened to my son Michael. One night when Michael was actually 4 months old, 1 month adjusted, he experienced the situation when milk went to his nose and clogged pathways there, and he didn't know how to breathe through his mouth yet. So he just started to suffocate and turning blue. We didn't know what to do at that moment. My husband just supported his head, and I used a nasal aspirator called nose feeder and just sucking the milk out of his nose, and it actually worked. Like after a few long seconds for us, it was forever, he was breathing normally, but I could tell that my son was very stressed out, and it took him a long time to calm him and get back to sleep. So can you please teach me and other parents how to prevent milk from going into baby's nose and how to properly handle this situation if this emergency happens?
Yeah, so it's very frightening when something like that happens. The parents really think that the baby's going to stop breathing.
He was turning blue, actually.
Yes.
Blue. I was like, oh, it was a nightmare. Okay, sorry.
No Yes, so reflux is correct, like you call it, and most babies will have it, especially the premature babies. I say it's the little feeding tube that goes into the stomach. There's a little valve in between that's very weak. They already are immature with their nervous system. Their muscles are weaker. So it just is a setup for a little bit more risk for the reflux. And what I encourage parents to do is, especially if it becomes a big issue, is to do smaller feeds more frequently so that it's less volume that's going into the stomach each feed. And then also holding the baby upright as long as you can. At night it's hard because you want to go to bed and you're like trying to burp the baby, and then it's wondering when, can I go ahead and just lay the baby down, and not having the longer periods of time to hold the baby upright so that the milk settles down.
For how long approximately to burp the baby and hold after feeding?
I would try to do the burping, and then a good 5 to 10 minutes at least that you're just holding them in that upright position, and even if they're asleep.
Even if they're asleep.
Yeah. And then we still recommend the safest way to sleep is putting the baby on the back in an empty crib without, pillows or blankets and suffocation risks. And then I also see some parents will try to elevate the bed at an angle there's some, I don't recommend putting like those wedges inside of the actual bassinet or pill or crib, because those can be suffocation risks if the baby rolls in a certain way. But some will put books under like the head of the legs of the crib or the bassinet. So from the bottom up, it kind of gives it a little bit. And I don't recommend a significant incline, because too, the baby can move. Just 10 degree should be good, just so that a little bit of gravity helps. And then we used to standardly recommend thickening the formulas. That's now being discouraged. And then there's just certain situations where we'll do that. It's not as common that we recommend that. And then if it's severe, we then have medications, but those also have side effects, and it's really weighing out the risks and benefits. So there's multiple things that we can do. But I did want to, if you're open to, I wanted to tell you what, say that happens to a baby, what the appropriate action would be. So I follow what the American Heart Association, the organization that teaches like the CPR and BLS, like basic life support and CPR. So what they recommend is picking the baby up. If you see the baby struggling or choking, then you take the baby. I wish I had a doll to demonstrate this, but I didn't have one. But you pretty much take one of your hands, and you want to be sitting down ideally for this. I know like you're panicked, but ideally you take the baby and you sit down. And then you take their face, and you want to put the pressure on the cheeks. You don't want to put pressure on their neck, but you have them facing downward, that you're cradling their face. And then the body would lay on your forearm, this part of your hands. And then you want to angle it such that their face is lower than their chest. So you will hold their head here, their body's laying on here, they're facing downward. And you put it on this is my right hand. I would put it on my right thigh. So it's the baby's facing downward, head is lower than the chest. And that also, with gravity, we're trying to encourage whatever's in there to come out. And then I would take my hand and I would do very firm smacks, like you're burping, but maybe even firmer, between the baby's shoulder blades. So 5 times I would do good taps, and then see if the baby starts crying, or if you see the milk start coming out, then you know, okay, it moved out and the baby's breathing. But if they're not, then I would take with my other hand, and I would take the baby's head from my one hand, and I would roll them over into the other hand. So now they're facing me in this hand. And again, I would bring them down. Their head is lower than their chest. So now in my left hand, I'm holding the baby facing me upward, but I also rested on my thigh, my left thigh, and I would take my 2 fingers, and I would find that middle bone, the chest bone, and on the lower part, not where you see that little round bone, but above it, you want to push also 5 firm times there. And these, like pressure, where you're doing rapid pressure, that helps to dislodge and bring up out of their airway whatever is blocking. And so if that doesn't do it, I would turn them over again, facing downward, do the 5 firm taps, and you do that until you see. But I've had that happen. I was in the office talking to the parents, and the baby's laying there, and I look, and their eyes are like, and they're not breathing, and they're turning blue. So I did that, where I turned them up facing downward and did those, and it just, that was enough to get it to move out of the airway.
Wow, such a relief.
Yes.
Okay, thank you. That was such useful information. Okay, so and it's CPR training. We can look into CPR training for babies.
So it's American Heart Association. That's the organization. I would do the BLS portion, the basic life support, but it's also helpful to have the CPR training as well, because if, in the event if the baby's heart also is not beating, then you do the CPR portion of it.
Next question, my favorite, and it's a lot of contradictory opinions on this question about vaccines. Do you suggest vaccinating preemies, micro preemies? Should we delay vaccines or not delay vaccines? If yes, for how long? And please just elaborate on this topic.
Yes, sure thing. So yes, it is a very controversial topic, and a lot of people have very strong opinions and regarding it. So I come more so from that perspective of, we're concerned that the premature baby is very fragile. We're concerned about they're not mature in like their nervous system and their respiratory system and their digestive system, and everything's a little bit more delayed than the full-term baby. And the thing that I worry about is that their immune system is also immature, and hopefully through breast milk, they're getting some of the antibodies from mom and to help support their immune system. But if they get exposed to like the whooping cough, which is still in the community, then if they end up getting it and they're in the hospital, they're going to not do as well because their lungs are immature. So that's could be a prolonged stay in the ICU for them. And there's also certain bacteria that we vaccinate against that can cause meningitis, pneumonias, ear infections in babies. So I have that perspective of I want to prevent that for the premature baby just as much as I want to prevent it for the full-term baby. And just from my experience and also from the studies that we have available about immunizations, the recommendation is the same immunizations that we would do for a full-term baby with the schedule that we would do. So typically, there's one that can be done in the hospital or like up until 1 month, unless it's a micro preemie, and then at 2, 4, and 6 months are typically when we're encouraging the other ones. And I'm not seeing that the premature babies are getting more side effects than the full-term babies. So I definitely worry more so, if they get exposed to that illness, how are they going to do? And can we prevent or lessen that?
Also, in regards special vaccines for preemies. I don't know if it's just for preemies, but I remember my son got, it's called synergies against RSV virus. Yeah. Can you please tell us what is this special vaccine and who needs this and when?
Yes, so RSV is a respiratory syncytial virus. It's one of the hundreds of viruses that are in the community. And we actually just this past winter had a huge surge of that virus. So it's kind of hangs around.
It's very dangerous.
Yes, it's very prevalent, and then sometimes we see it mutate and just become much more aggressive. So the premature babies and even the young children, I see when they get that virus, it tends to affect the lungs even more than if an adult gets it or an older child. So they have a harder time, and then the premature babies already, their lungs are still developing and much more sensitive, and that just really puts them at a disadvantage. And there's certain criteria. The criteria change, so I'm not going to go through the current guidelines because it could potentially change over time. But the baby's doctor would know if they qualify. A lot of times they're starting in the hospital if the baby's there long enough and meets the guidelines. But it's really to try to prevent the baby, or at least minimize the baby's illness if they get RSV. And it is at this point a monthly immunization geared to help boost the baby's immune system against the respiratory syncytial virus.
So that's the only one, the RSV virus is the dangerous for preemies, or other viruses in the community also we should vaccinate our babies?
Yes,
I mean besides the regular ones.
So at this point, for the premature babies, beyond what we recommend for the full-term babies, according to the American Academy of Pediatrics vaccine schedule, the Synagis is the only addition. And then once they're 6 months or older, then we offer the flu vaccine as well. So that then becomes an option as well. But that's also for full-term babies or premature babies.
Sounds good. Thank you.
Yeah.
How does caring for preemie differ from caring for a full-term baby? Are there any special measures or precautions parents should take?
Yes, so premature babies end up being smaller and weighing less. They don't have that fat layer that some of the full-term babies come out looking plump and
Exactly.
So I really encourage parents, and a lot of them come out trained very well by NICU as well, to realize that the baby's ability to regulate their own temperature is not as good, and so the parents need to be mindful of that. So I encourage them not to underdress the baby, but we also don't want to overdress the baby, because that also can not be so good for them. And then feeding is another thing. A lot of the babies starting off, depending on how premature they were, they may have had to be fed through an IV at first or through a tube, and then transitioned to doing the oral feeds. So that's another thing to consider, is that whole progression of how is the baby going to be feeding, and the whole calorie, the caloric intake of a baby. That's also something, I'm sure you experienced that with Michael, how they would calculate it out, and they had a nutritionist, and they really follow the weight gain and expect him to eat a certain amount for what we expect him to gain. So there's a lot more focus on nutrition and making sure the baby has that optimal caloric intake to help with maximizing their weight and their growth and head circumference.
And I also remember NICU, they told me, like, usually you can feed the baby if it's formula or breastfeeding, like on the arm, right? On this, like this. And with preemie, they usually hold it in this
sitting
position. Yes.
Yes.
Very, very weird in my opinion, but that's how I've been told in NICU to feed Michael in the beginning, at least a few months, even at home.
Yes, and that too, just helping with the gravity, bringing the food down, and there's so many different nuances that we end up in modifications of what we have to sometimes have parents do, because we have to accommodate certain other things for a premature baby